Are you okay?
Hello, happy Wednesday. Welcome to the first school health update call of the school year. Thank you all so much for taking the time out of your busy schedules to come with us to just talk about school health. My name is Christopher Call. I'm one of the school health liaisons for Pima County Health Department. For those who are new, the school health update calls are an opportunity to update on epidemiology disease tracking, as well as share resources to health staff, as well as community, or as well as mental health. Um, I would like to also remind everyone to take a time to make sure that you are muted, just so that the presenters who are presenting could have no interruptions. With that being said, I'm going to go ahead and get us started. So the agenda, we just have one announcement. Then we're going to have our epidemiology update, as we usually do, followed by our heat safety presentation, then by our heat team. And then we will have an air quality presentation by the Pima County Department of Environmental Quality. And of course, at the end, we'll always save time for Q&A. With that being said, the only announcement we really have right now is next month's presentation is going to be on pool safety, teen driver, responsible teen driver, and teen lifeline. So without further ado, we'll go ahead and get started. George, are you on the call?
I am.
All right, the floor is yours.
All right. Hello, everyone, and thank you for joining us. My name is George. I'm an epidemiologist with the Health Department, and I'm going to give an update on respiratory diseases, specifically COVID, RSV, and flu, followed by a little bit of a talk on hand, foot, and mouth disease. Let's begin. Next slide, please. So this is our RSV epi curve. It just shows a 5-year average for the season, which is the dotted line, or solid line, I'm sorry, and last year's data in the dotted line. Typically, we see a spike for RSV in the months of February, mid-February, and it starts tapering off by the end of March. Right now, because our respiratory season runs from October to 2025 to September 2026, we're seeing right now, very little activity. We really start seeing a lot towards the end of the year. We have, for the entire season to date, this year, respiratory season, we've seen 810 confirmed cases, which is less than we usually see. Also of note, RSV affects mostly the 15 to 64-year-olds category. That's the majority of the cases. We see 32%. And the next age group that sees the most is the children 1 to 4 years old. Just FYI, there were no cases in the last week, and there were no cases the week prior to that. Next slide. Thank you. For flu, same thing. We're towards the tapering down to nothing for the scene for the most part for the current respiratory season. There were in 4,476 cases so far this season. We don't expect to see a whole lot more. It's less than we saw last year. And again, the age group most affected by flu are the 15 to 17-year-olds. And 18 to 49-year-olds being the next age group most affected. Last week there were 6 cases, which was 500% more, which is really not that relevant. I mean, we're again at the end of the season where things start to taper off significantly. Next slide. So for COVID, obviously our 5-year seasonal average, it looks a little bit skewed because of the pandemic data. Last year we had considerably more cases than what we saw last year in this season. So we're not seeing a lot of activity, but for the entirety for this season, there have been 2,700 COVID cases, and that's about 95% less than we normally see or what we have seen last year or the 5-year average. Again, most of the people affected are 65-year-olds. and the 19 to 44-year-old age group is the second most affected. There were 57 cases the last week, which is a little bit more than we saw in the prior week. Um, it's kind of, I just want to note that when we say confirmed cases, I'm referring to cases that are primarily seen in the ERs. So we know that there are actually more cases out there than what we actually see, but the ER cases is how we can actually count confirmed cases, and that's about the only way we can actually tell you it's confirmed, a confirmed case. Moving on, next slide. Taking a look at the overall respiratory disease rate. This past week, there have been 6 flu cases in total, 0 RSV cases, and 57 COVID cases in total. You can see the curve where most of our cases are flu in the past, but our things are tapering off. We've seen a little bit of an uptick in the number of COVID cases recently. I don't have really an explanation for that, except that that's what we see happening. We can go on to the next slide. Okay, I'm going to kind of segue here into just before I start talking about our next subject, the list of reportable diseases that we have and the amount of time that we allow for reporting. Most of the diseases require reporting within 24 hours. And the chart, I think varicella is the only one that I know of that has a different reporting schedule, and I think some generic diarrhea, nausea, vomit. I mean, has a different key for reporting. This slide is available. You see down at the bottom where it says ADZHS, AZDHS government school reporting. It's available online, and you can take a look at that whenever you can. And I think these slides will be available after this meeting. Next slide. So I want to just point to the fact that we do have some slides, posters available that are available through the CDC. There are links to these posters available. You can see at the bottom of this slide. You can just click on these and get these. You can download these and print them. Let's go to the next slide. Okay, these are actually just some ways to some aids that you can use that are available either through the CDC or for the Arizona Department of Health Services website. And these will be available when we distribute these slides. So these are all resources that you can use for outbreaks, vaccines, respiratory data portal. That's what I just presented to you, and some of the disease control and information about how to keep some of the diseases at bay. Next slide. Okay, I want to talk a little bit about hand, foot, and mouth disease because we're seeing a little rise in the number of cases. Next slide. So it's very highly contagious, and it's children young children tend to be affected more than others, and that's because they're constantly touching things and sharing things and putting their hands in their mouths. Uh, that is not to say that other people and older people can't be affected or get infected by it, but generally we see most of our cases in children 5 years and younger, and that's because they're in preschool together and they're sharing a lot of different things and surfaces and touching. Um, the hallmark of it is our mouth sores and a rash on the hands and on the feet. The mouth sores will be most prevalent, and we differentiate hand, foot, and mouth from other skin type diseases like varicella or measles, even, in that a lot of the sores do not start on the at the forehead like measles, nor are they generalized like varicella. So one of the hallmarks is the mouth sores. Um, it is a disease that's around year all the year. We have seen a lot of it in daycares and schools. Again, younger children, it spreads rather quickly. Um, Also, caregivers who are feeding and changing diapers, dressing, and generally just doing what kids do. Um, the rash appears about for maybe 3 to 5 days after exposure, and the symptoms last about 7 to 10 days. So the way it spreads is by hugging, kissing, touching surfaces, talking, sneezing, lots of ways, but it's very contagious and it's a kind of a pain to get rid of. Let's next slide, please. So prevention would be to wash your hands as frequently as possible. If you have a case of hand, foot, and mouth, in a congregate or school setting, it's important to make sure that um, the child usually can be kept out of school until the rash subsides. Uh, but if the rash is not necessarily, if it's not prominent on the body, it can be covered to some degree, but washing your hands and having everyone wash their hands who is around the child or any of the children who might be affected is the best idea. Avoid touching your face and hands to your face. Uh, Clean and disinfect and avoid close contact with anyone who has an infection. Um, it's noted that there's no vaccine in available for hand, foot, and mouth. Next slide, please. So disinfection would normally be recommended bleach be used. The amount of contact time for the bleach is, I think, 20 minutes, 10 to 20 minutes. That's quite a long time. In a lot of the schools and school districts, um, bleach is not allowed to be used. The EPA website does list some alternative ways of cleaning toys and surfaces, and that'll be available on the slides or links to those resources. Um, but it is important that all surfaces where if a kid is infected within a classroom or any kind of congregate setting, that things be disinfected as soon as possible and as frequently as possible because it will spread rather rapidly. Um, Next slide. So, hand, foot, and mouth is normally mild, is what the slide says, but it it's just very contagious. So, uh, a child can attend school as long as they don't have a temperature or a fever, and they can return to school after there's no fever for 24 hours. Um, and or feel well enough to actually participate in school. Also, are not drooling. Um, uh, but I would recommend excluding the child from school if there are any symptoms oncoming or existing, because, as I said, it spreads very easily and very quickly. Um, let's have the next slide. Okay, that was it for me. I hope this was informative, but you can shoot questions to the EPI department at Pima County for any questions you might have. And that's all I have for now. Thank you.
Thank you so much, George. I appreciate it. So next we have our heat safety team with Betsy and Nate. They'll talk to us about how to keep cool in this hot Arizona summer, or I guess going to be hot Arizona fall. Anyways, the
Yep.
floor is yours.
Thank you. Hi, everyone. My name is Nate Young. I'm with the Office of Heat Response and Relief. I think Betsy's on the call, but I'll be giving the presentation today. And yeah, the summer is officially over, but the heat is not yet gone. And so if we can go to the next slide, just a few reminders about heat. Heat is going to be the number one weather-related cause of death in the country. That is especially here, or true here in Arizona. We've been seeing rising temperatures each summer, and we know that we're just getting more and more days of extreme heat each year. We know that everyone is affected by heat, but not everyone is affected equally. And so we know that a few certain populations, like young people in general, people who are being more active outdoors, people who have chronic conditions, who are taking certain kinds of medications, people who are unhoused or just don't have stable AC access are going to feel more of those negative heat impacts. Um, and even just as recent as this year, we're seeing that the heat season is expanding. The past few years in Pima County, we've experienced 100-degree days in October, extending into mid-October. We've seen hospitalizations, we've seen heat-related deaths extending into mid-October. And for the first time ever, we had 100-degree weather in March, and we actually experienced a few heat deaths in March this year, unfortunately. We could go to the next slide, please. We have some updates on our heat epidemiology from courtesy of Cheyenne from our MP department. On the next slide, you'll see that our heat-related hospital visits in Pima County are essentially approaching our seasonal peaks. The black trend line is going to be the trend from 2025 when it comes to HRI visits. We've been following that trend line fairly closely this year, with the exception of the March heat dome, which you can see around week 11 of the year towards the beginning of the chart. So far, we've had just over 90 hospitalizations as one of the busiest weeks in Pima County. But we also know that July, the end of July and early August is considered to be peak heat season. And so we may have some more spikes in hospitalizations before the heat season is over. On the next slide, it'll give you a breakdown of who is experiencing these illnesses and who is going to the hospitals. So right now, a very small minority of these cases are being seen in very young children between the ages of 0 and 4. We do see that climb a little bit for children between the ages of 5 to 17, but the vast majority of our illnesses are going to occur in middle-aged adults, people between 18 through 44 or 45 through 64. Men tend to be more susceptible to heat illness when we look at the numbers. So far this year, 67% of our cases have been males, and that pretty closely mirrors previous trends from previous years. White and Hispanic demographics tend to make up the bulk of our cases. And I always like to point out the housing status because we do have some children in schools who are sometimes unhoused but are still attending school. 11.7% of our cases so far this year have occurred in the unhoused community. That's actually a 2% increase from last year. We're not done with the season yet, but it is a pretty noticeable increase in terms of our surveillance data. And we know that less than 1% of the county are actually homeless. And so they're very overrepresented when it comes to this data. On the next slide, you'll see a chart of heat-related deaths and some of our climate data. These gray bars are going to correspond with National Weather Service heat warnings. So you can see we had those unfortunate cases where in early April and late March, we had that heat dome come in and we did experience a few heat deaths here in the county. We have seen them occur pretty steadily throughout June and July. Please keep in mind there can be a few weeks to a couple months lag when it comes to this death data, so we won't get the full picture until the end of the season. But this is what we've experienced so far. On the next slide, we'll see a similar breakdown where we have 49 recorded cases so far this summer. We see that the vast majority of these are going to be in seniors. And so even for our teachers and some of our faculty and staff at schools, if they're having to work outside or being exposed to the heat, we want to make sure that they are being safe, they're taking breaks, or hydrating. We tend to see a majority men in the cases of heat-related deaths in the county. Similar to illnesses, the white and Hispanic demographics tend to lead the numbers. The disparity with the unhoused population is actually greater when it comes to deaths as well. We have 22% of our cases occurring in the unhoused community as opposed to 11. And so far this season, 27, which is about 55% of our deaths have occurred outdoors, whereas 45% have occurred indoors, which pretty closely mirrors previous seasons as well. On the next slide, you'll see that in terms of heat contributed deaths, which is a case where heat was not the primary cause. One of the cases where a primary cause may be applied is something where somebody goes hiking, they're exposed to the heat, and they pass away. Heat contributed deaths means that heat was a factor, but it was not the primary cause. So we had a fall-related heat death. We've had half of them occurring with natural disease. One of them was unclassified for here, and 13 have been related to overdose. We like to highlight the natural disease because we know that people who have chronic conditions, especially things involving hypertension, cardiovascular disease, any kind of kidney disease or anything like that, tend to be at a higher risk for heat-related illness. And so any students who are experiencing those conditions or who may be taking medications related to that may also be at a higher risk for heat illness. The next couple slides will go over some heat safety tips. And so the next one will be just the difference between an extreme heat watch and an extreme heat warning. We just had an extreme heat warning this previous weekend. It's likely we'll still have a couple more before the season closes out. And so if you're familiar with tornado terminology, it's essentially the same. An extreme heat watch or tornado watch means that extreme weather is possible, but it's not confirmed. When we get that extreme heat warning, though, that means that we know the dangerous heat is happening or is about to happen. Whenever that occurs, the National Weather Service will issue an alert. And later in the slides, you can see that you can actually sign up to receive extreme heat alerts. And we'll put the link to that on these slides later. But that's just one thing we can do in order to be aware and be prepared for the weather, is just to be aware that it's coming. And maybe we can adjust some of the activities, like reducing the amount of time students are spent outdoors in order to just keep people safe during these times. On the next slide, you will see that we did just have an extreme heat warning, and this was actually changed since I made these slides because this says that it was occurring Thursday through Sunday evening. It was actually extended, so we had a warning between Thursday and Monday night. It's possible we'll have more of these throughout the summer, so we're just advising people to stay posted. On the next slide, we link to a tool called the heat risk tool that the National Weather Service provides and the CDC also promotes. It will actually assign a heat risk for the day for specific locations. And so if you go to their website, you can actually type in the address of your school. It'll tell you whether you have a mild, moderate, major, or extreme heat risk. Mild and moderate heat risk typically affects the most vulnerable among us, and so it's especially more dangerous for people who are working outdoors all day, for seniors who maybe have chronic conditions and are spending time outside or don't have access to air conditioning. But major and extreme heat risk is when it is so hot outside that it poses a threat to essentially the entire population. And so for major risk, that's going to be most of the population. It means that temperatures are not going to decrease significantly at night. They're probably going to stay in the low 80s or around 80 degrees instead of cooling off to a nice, comfortable temperature. And we just suggest people are drinking plenty of water. They're wearing lightweight, light colored clothing. People are avoiding outdoor activities during the warmest parts of the day. So that may mean rescheduling practices, moving them indoors, rescheduling fire drills, and that we try to stay in air conditioned locations, especially during the hottest parts of the day. Extreme heat risk is going to essentially encompass all of that, except the heat is going to be worse. We just kind of recommend that people check on each other whenever these conditions occur, because you never know when someone is going to get that onset of heat illness, and it can progress pretty quickly. And so if you see a student who is maybe struggling or looks a little sick from the heat, just always err on the side of caution, try to get them indoors, try to get them to sip some water, so that way they don't progress into a severe illness. If you go to the next slide, you'll see that the CDC page is shown where you can actually put in your location and get your heat risk for the day. The CDC page will also give you some safety tips as well. We also have linked the National Weather Services page at the bottom left corner. And so if you prefer to go straight from the source, I think they actually get a little bit more specific in terms of the location heat risk. But either of those websites will give you the same kind of information on what the danger is for your location for that day. In terms of safety tips, the next slide will talk about staying hydrated. We encourage everyone to drink water regularly and consistently, and especially for kids who are being really active. We don't want them to start drinking water after they exercise. We want them to be drinking water beforehand, throughout the day, so that way they're not dehydrated once they start sweating. We're encouraging people to avoid sugary, caffeinated, or alcoholic drinks. Hopefully, we're avoiding alcoholic drinks in schools in general. But for folks who are playing sports, who are sweating a lot, or maybe some of our staff members who are working outdoors, it can be good to include some electrolytes in your drink mix, or to drink something like a Powerade, Gatorade, some kind of sports drink to replenish those electrolytes. And something that kids typically love to laugh about, but can be educational, is that you can check your urine to see if you're hydrated enough. Darker urine is typically an indicator that you are not drinking enough water, whereas very light colored or almost clear urine means that you're pretty well hydrated. The next slide will show some examples of what to wear. And so we encourage people to be wearing loose, lightweight, and light colored clothing. I don't know what it is. I often see young children wearing, like sweaters and hoodies, even though it's super hot outside. They may prefer it, but it's not necessarily the safest materials to be wearing. And so anything that has some natural fabrics that can help keep the body cool is what we generally encourage kids to wear. Sun protection is also important. That can mean hats, that can mean umbrellas, sunglasses, or sunscreen, especially for children who are playing outside or doing some kind of outdoor sport. The next slide is going to be a recap of some basic first aid tips for heat-related illness. We have some handouts that are available on our website that you can look at or download that go over what heat exhaustion is versus heat stroke, especially for children who have maybe never experienced this or had any kind of education about it. It can be important to talk to them so that way they can recognize these warning signs before they start getting too sick. For heat exhaustion, anything involving fainting, dizziness, a quickened pulse or a weak pulse, a body that's sweating a lot, starting to get cool, pale, or clammy, can all be warning signs of heat exhaustion. We encourage people to try to act fast in terms of cooling them off. You can utilize cooling towels to cool them off. You can bring them indoors, get them in the air conditioning. That's typically one of the best things you can do, and have them take small sips of water, but do not have them chug it or drink large amounts very quickly, as it can lead to nausea. Some other minor heat illnesses can also include things like sunburns or even heat cramps. And so if we have students who are starting to cramp, we recommend they stop activity, they start to rehydrate, drink some water, drink some electrolytes, that they stretch and just kind of massage the affected area. If they start feeling better after a little bit, they start rehydrating, normally they can kind of go back to what they were doing. But if they continue having issues, it might be best to just take a break for the day so that way they don't progress to heat exhaustion. The next slide is going to go over the more severe form of heat-related illness, which is heat stroke. This is something where typically you can't just self-resolve this on your own with getting someone some water and some air conditioning. It has progressed too far at this point. And so if we see people who have been exposed to heat and they have stopped sweating because they're so dehydrated, their heart is beating very fast and very strong, they're presenting a fever, and they are potentially unconscious at this point, we recommend calling 911 right away, especially if the condition's not improving. We do not recommend giving them water at this point because, especially if they're unconscious, it's unlikely they'll be able to drink it. And even if they can, it's very unlikely they'll be able to keep those fluids down. We do recommend that you still try to get them into a cooler place and just kind of cool them off however you can. So even though we're not trying to hydrate the person anymore, you can place them in the recovery position, try to keep them lying down. If you can get them into air conditioning, if you can get some cool water on them or place a cooling towel on their forehead, the back of their neck, or anywhere else that can help cool them down, that'll be good and will kind of help prolong the time they have until emergency services arrive. In terms of what we can do to be prepared for any heat emergencies, the next slide will show just a pretty short list of things you can try to keep on hand and have ready in case anyone starts to experience heat illness. That can include water bottles, it can include electrolyte packets or electrolyte drinks. Squirt bottles filled with water can be great, especially so that way you can kind of squirt it on them, help cool them off. Ice packs are great. They work similarly to cooling towels, where you can kind of place them on the neck, on the face, or other places in the body, like the armpits, to try to cool people off. Shade structures are great. Shade is a wonderful way to present a barrier between you and the sun and help mitigate how fast you are heating up. And you can also use fans and misting fans, but especially now with how hot it is outside, we just want to give people a warning that fans typically do not work unless the heat index is lower than the body temperature. So when it's 100 degrees outside, a fan isn't really going to cool anyone off. It's really just going to blow hot air in their face and can actually make them hotter quicker. And so the heat index needs to be lower if you would like to use a fan. Otherwise, if it's too hot indoors or too hot outdoors, you may just be making the situation worse. We do have some heat tips on our website as well. On the next slide, you can see a little screenshot of one of our handouts, but we do give some tips on outdoor activities that you can look up as well, especially for people who are working with kids who are playing sports outdoors. We have handouts on the next slide on medications and heat safety. And so you can pull this from our website, but we know that some medications can change how we sweat. They can change how we perceive our own body temperature or how we're feeling. They can make us dehydrated. And so the next slide will show that there is a long list of certain kinds of medications that can affect your heat risk. And we encourage you guys to just kind of familiarize or download the list yourself. And if you notice any students are on it and they're struggling, that they follow up with their doctor to talk about how to stay safe. We have another slide with some helpful heat tips. I don't think we have time to go over all of them, but I believe that this meeting is recorded, and I can also put my name in the chat, and so I can give you guys these links or follow up in terms of giving you any materials you would like. But just in general, you can sign up for heat alerts from the National Weather Service. You can sign up for school heat alerts, specifically with the state health department. We recommend just avoiding outdoor activities and trying to move them to the earliest parts of the day in order to avoid the heat, and not really hosting those in the afternoon. Familiarizing yourself with any heat policies your school may have, and then doing small things like not relying on fans, and just kind of like blocking windows to prevent that solar radiation from coming in. And then before I talk anymore, I believe we have a few folks from ASU with the Heat Ready Schools initiative who would like to take a couple minutes to talk about their work and kind of what resources they provide to schools as well. Um, is Mary on the call?
Here.
I think if we go to the next slide, you can kind of take it
There
from
we go.
there.
Awesome. Thank you, Nate. So, hello, everybody. My name is Mary Munoz Encinas. I am the research coordinator for the Heat Ready initiatives at ASU. Our biggest program is the Heat Ready Schools program, and this ties really well with all of the awesome resources that Nate just shared with you. So, essentially, we were created to try to best serve schools to protect those most vulnerable, which are children from K through fifth grade. But of course, we want to protect not only the kids, but the whole staff and the wider school community, meaning parents, neighbors, etc. So we have a series of recommendations in 5 action areas, which are training, prevention, school policy, built-in natural environment, and community engagement, meaning we do a holistic kind of approach to how you want to approach, sorry for being redundant, how you want to deal with extreme heat in your school based on your capacity, your resources, and your priorities. So we have a bunch of different resources, again, that this would be additional to what you can find in the Pima County Health website. You have a QR code there for our site. You will find our Heat Ready Schools tool or rubric, which is where we start to kind of plan ahead for what you would like to do, what you want to focus on. If it's trying to find shade for your school, we connect you with grants. If you want to establish a heat portion in your all hazards plan, if you want to get training for even your maintenance staff on how to take care of your trees as a long-term shade commitment, materials for nurses to help kiddos detect, right, the heat-related illness symptoms on themselves and be able to communicate it with the educators. So a gamut of different resources. We also provide technical assistance if any of you guys wanted to, get really into the weeds of a specific intervention that you'd like to do in your school. We are happy, again, to connect you with resources and provide guidance. So again, we're an open resource for the community. We are based in Phoenix, but we do work all over the place. So feel free to email us at heatready@asu.edu with any questions. If you go to heatready.asu.edu, which is that second QR code, you are able to sign up directly, and then we can start kind of like a one-on-one approach to figure out, again, how we can best serve you, how we can get resources to your school, and really make sure that it fits your context, your priorities, and your needs. So I will pop in my information in the chat. You guys feel free to, again, reach out for any questions, any concerns, and any ideas. Again, if there's something that we're not addressing and you'd like for us to talk about, we'd love to start that conversation. Yeah, thank you.
Yeah, thank you. And I know I'm right at time, so I'll speed through these last few slides. Part of my job is also to coordinate the cooling center initiative across Pima County. We've increased the number of locations this year from 35 to 48, and so we're very happy about that. There are more access points than ever throughout the community, and so we just encourage you to familiarize yourself with nearby cooling centers. You never know when you may need it or when a student may need it. Maybe the power goes out or the AC stops working. On the next slide, we actually just recently opened one fairly close to some schools at the Los Niños Park, where this one is actually operated directly by the health department 7 days a week. We have afternoon and some early evening hours, and we try to post some family-friendly games, books, and activities. We also have some heat relief supplies and educational materials there. So especially if you're nearby this location, feel free to step in the park and check us out and maybe take a few of our handouts back to your office. The next slide is also going to discuss an opportunity for youth. And so if you think you know any students who might be interested in getting up to $5,000 for youth-led climate projects, the City of Tucson is sponsoring a Youth Climate Action Fund where students can kind of propose projects. It is eligible for children aged 15 through 24, and they can apply for microgrants for things like natural cooling infrastructures, just pretty much anything that's going to build a greener, healthier, more resilient Tucson. And so there's lots of different things that could potentially fit into that. There are a few QR codes you can scan if they're interested and want to get some more information. And I believe just next week on the 15th, it's a little hard to see on this slide, but sometime next week, there is going to be a meeting to discuss how to apply to this opportunity as well. But that is all I have today. My contact information is on this slide. If you have any questions or you would like to follow up on any of the resources I discussed during today's presentation, I'm also going to put my email in the chat. And so you have that just in case you can't find the slides later on. But thank you, everyone.
Thank you so much, Nate. I appreciate it. Next, we have our air quality presentation by Arisha. Arisha, are you here?
I am here. Hi, Chris.
Hi, the floor is yours.
Hi, everyone. As Chris said, I'm Arisha Lee, and I'm with Pima County's Department of Environmental Quality's Climate and Community Engagement team. In July of 2023, PDEQ, the Pima County Department of Environmental Quality, partnered with the University of Arizona's Asthma and Airway Disease Research Center and their College of Public Health. And together we submitted a grant proposal to the U of A, the Environmental Protection Agency, and we were awarded the grant to expand air quality monitoring at Pima County schools to address environmental justice. So today I'll briefly walk you through the project as a whole and then focus on our educational curriculum that we developed as a part of this project. And we just got the curriculum finalized, and it's a great time with school beginning to start letting everyone know about our curriculum. So why did we apply for this grant? So research has shown that low income and minority communities are often exposed to higher levels of air pollution, which can increase the risk of asthma and other health problems. And Pima County already has a regulatory air monitoring network, and these monitors are designed to primarily determine whether we meet federal air quality standards, but they don't necessarily give us a detailed picture of what air quality looks like at the neighborhood level, particularly in underserved communities. So this project was designed to help fill that gap. And through this project, we installed 20 low-cost air quality sensors. Well, low cost relative to our regulatory air monitors at PDEQ throughout Pima County, with a focus, as I said before, on communities that historically have less access to localized air quality information. So PDEQ operates 15 regulatory air quality monitors throughout the whole county, Pima County. So they're very spread out. And like I said, those are for federal requirements, for meeting federal requirements. But there are still limitations when it comes to understanding localized pollution levels, especially at the neighborhood level. So the sensors that we installed at the schools collect information on several pollutants that particularly affect our health. And those pollutants are particulate matter, carbon monoxide, ozone, and nitrogen dioxide. And but this project wasn't all about installing the sensors. We also wanted to make the information useful and accessible. So in addition to creating the sensor network at schools, we developed a public air quality dashboard, and the data from these sensors are used to support research and modeling that can help predict air quality in areas without our regulatory monitors. And we also, as I mentioned before, created an educational curriculum to help students access and understand local air quality data in the neighborhoods that they're living in. So together, all of these pieces help support our larger goal of improving access to air quality information and addressing environmental justice. Actually, so if you could go to the next slide with community partnerships. Thank you. So a really important part of this project was creating partnerships with local school districts. So we worked with 8 school districts across Pima County. So as you can see, we partnered with TUSD, Marana, Sunnyside, Tanca Verde, Vale, Swarita, Flowing Wells, and then Ajo. So that means that we have a sensor in at least one sensor in all of these school districts. And we partnered with schools because they're a natural partner, because they're a trusted community institution, and they also provided a secure location where the sensors could remain over the long term. And they also gave us an opportunity to connect this air quality data and curriculum directly with students and educators. And if you could go to the next slide, please. So by June of last year, we had installed 20 air sensors in addition to our regulatory monitors. So 19 of those sensors are at schools located throughout Tucson, mostly Tucson, and the one in Ajo. And we have one sensor at our regulatory monitoring, at one of our regulatory monitoring sites, just to help calibrate our sensors. So, or the rest of the sensors, so that we know that the data that we're providing to the community is accurate. And the sensors are battery solar powered, and they have battery storage, and they're connected to the internet. So they're transmitting data remotely. And at this point, we've been collecting data for about a year now. And then we also wanted to make sure that this project could continue when the grant ended, which the grant ended about a month ago. So we also included air quality data from PDEQ's regulatory monitoring network. So that has been included in the curriculum. So if in the future the dashboard and the data from the sensors is no longer working, a lot of the curriculum will still be viable. And if you could go to the next slide, please. And I just mentioned our dashboard. So one, as I've already talked about, one of the projects that we produced was the Sunset Dashboard. So this was developed by the University of Arizona's Health and Urban Modeling Lab, which is a part of the College of Public Health. And it provides the public with near real-time air quality information through maps, graphs, tables, and downloadable data. And this dashboard is really useful for students and is a big part of the activities in our curriculum to allow students to be able to compare air quality data at their school or a nearby school with air quality data at other schools around them. It also gives them the opportunity to work with data, real data that is being collected in their neighborhood rather than relying on examples from a textbook. And if you could go to the next slide, please. So that brings me to our curriculum. And this curriculum was developed for high school students, and it's aligned with national health education standards and Arizona science standards. So the goal was to take all of the information from all of the tools that I've just talked about and turn them into something that teachers and students could actually use in the classroom. And I was a high school science teacher in TUSD for a little while, and I did a lot of work in creating this curriculum, and I would have been ecstatic to have this curriculum handed to me because like I said, they're aligned with national and Arizona science standards. We have a do and say portion. All of our activities have an answer key for teachers. We just made it super, super easy for teachers to use. And then through the curriculum, students learn how to understand what common air pollutants are and where they come from. They explore the relationship between air quality and human health. They learn about air monitoring and the scientific process. There are a few activities where they download the local data and they analyze and interpret the data. They also investigate patterns in the data. And then one really fun piece of the curriculum is case studies that involve local and national environmental justice issues. And then they apply scientific evidence to community-based problem solving. And the last slide, please. And before we finalize the curriculum, we want to make sure that the activities work with actual students. So we tested some of the activities through our Youth for Blue Skies after school program and the University of Arizona science camps. So this allowed us to see how the students responded to our materials and to identify areas that needed clarification or adjustments. But overall, every time we've used activities with our Youth for Blue Skies students or the Arizona or students in our Arizona summer camp or that we've participated, the Arizona Science Summer camps that we've participated in, they've gone really well and the students have really enjoyed the curriculum. I also want to point out that we have 3 modules and 7 activities, and some of the activities are definitely appropriate for middle school students. And You don't have to use the entire curriculum. A lot of the activities are standalone activities. And I will put a link in to the curriculum in the chat. And I also have my email address in the chat. And I'm in the final stages of developing a presentation. Actually, these slides are the first part of my presentation, and the second part goes into a deeper dive into the curriculum, and I have videos guiding teachers through the websites, how to navigate through our different websites, how to download the data, how to easily instruct students on how to make graphs and read the data or identify the patterns that they're seeing in the data. So that will be on our website very soon. And that is all I have for today. Thank you.
Awesome. Thanks so much, Arisha. So with that being said, are there any questions for any of our three presenters today? You can go off mute or put your questions in the chat. And while we wait, I can also say that if you have any questions, health related, mental health related, you can always reach out to us at 520-724-7018, or you can also reach out to us at our school support line at schoolsupport@pima.gov. But with that being said, I see no questions in the chat. I hope you all have a wonderful Wednesday, and we'll see you again on September 2nd at 1 p.m. Thank you all so much, and I hope you have a wonderful day.
Thank you.